Dr. Roman Hunter, and today we're going to be talking about manual muscle testing, otherwise known as MMT. Now, MMT has 6 grades, from grades 5 to 0. Grade 5, otherwise known as normal, is when the person is able to complete full range, or in other words, throughout the available range of motion, and is able to hold against maximal resistance. The muscle is able to hold against maximal resistance. For grade 4, otherwise known as good, is when the person is able to complete the full range or the available range of motion and is able to hold against moderate resistance. So if you were to apply maximal resistance and the person breaks, that would be a grade 4, right? So it's moderate resistance. For grade 3, otherwise known as poor, or fear rather, my apologies, is when the person is able to complete full range without manual resistance. So they're able to complete full range or go through the available range or go to any range just against gravity, in a gravity maximized position. All right. For grade 2, otherwise known as poor, is when the person is able to complete partial range. They're unable to complete the full range, just partial range, or you put them in a gravity minimized position and you're able to perform the full range in a gravity minimized position. All right. For grade 1, otherwise known as trace, is when the person just has a palpable contraction or a visible contraction. And for grade 0 is when there is no visible nor palpable contraction occurring in the muscle. And 0 is otherwise known as, you guessed it, 0. All right. So when performing MMT, you want to make sure that the body part is exposed. You don't want to have it fully clothed or you have bulky clothing over the area that will limit the range of motion, and you won't be able to see any visible muscle contraction occurring. So you want to make sure that the area is exposed and you drape them accordingly. All right. Now, in terms of, just before we go, I just want to also mention that for some joints there may be some arthritic changes that will affect the range. So the person may not be able to perform full normal range of motion just because of arthritic changes occurring within the joint itself. May also be due to capsular issues or some internal derangements occurring in the joint. So you allow the person to take the limb through the available range that they have within their capacity, through the available range, or you take them to the end of their range. They're able to take themselves to the end of their range, and you perform the test within their available range that they have. All right. So this is MMT, manual muscle testing, that we'll be talking about. Hi everyone, my name is Dr. Roman Hunter, and today we're going to be doing a manual muscle testing, MMT, for elbow extension. Now the primary mover for elbow extension is the triceps muscle. All right. Now we're going to go ahead and show you the starting position for the patient as well as for the therapist, and go ahead and show you how the movement is performed and how the test is done. All right. Thank you. Alright, so we're going to be performing MMT for elbow extension. We'll have the patient here in prone line. So the person is lying on their stomach with the shoulder at 90 degrees abduction. You want to make sure that their hand or the forearm is hanging down, almost like perpendicular to the floor. The position of the therapist can be by the head of the patient, or if you want, the person can also be over by this side to perform the movement. If it is that you want to get a better visual of the person's face while performing the movement, if they're grimacing or if they're having any signs of discomfort, then you can stand at this side and perform the movement. Whichever position that's more convenient at the time, and with regards to the spacing that you have, then you position yourself accordingly. All right. So for the purposes of this video here, I'm going to stand right here by the head of the patient, and what we're going to be doing is I'm going to go ahead and give the instruction. This will be the stabilizing hand. So the stabilizing hand will be going under the distal arm. Stabilizing hand under the distal arm, and you're going to go ahead and give the person, the patient, the instruction. Go ahead and lift this hand up towards the seam. Just straighten the elbow for me. Straighten the elbow. All right, good. So they're straightening the elbow. You can put a slight bend in here, just a little bit. Keep it right here. All right, fine. Hold it in that position. Not to lock it out, because when you engage the locking mechanism of the elbow, then you won't get a proper reading, and the test won't be done properly. So you just want to take it out of that locking position of it, so that you can go ahead and perform the test. And the testing hand is positioned distal forearm, distal forearm. So hold it, don't push it down, hold it, hold it, hold it, hold it. All right, fine. And that will be a grade 3 when the person is able to perform the full movement without any resistance. If it is that he had broken form or unable to take the maximum resistance, that will be a grade 4. A grade 4 is also if the person is able to hold under moderate resistance. Alright? So I was going to go ahead and show you the position and technique for grades 2 to 0.
Go.
Alright, so for grades 2 to 0, for MMT elbow extension, the person is in a short sitting position. Now, once the person is in a short sitting position, you're going to abduct the shoulder, so about 90 degrees abduction in a neutral position. And the elbow will be about 45 degrees flexion. About 45 degrees elbow flexion, alright? So, what we're going to ask the person to do, this will be a gravity minimized position. Go ahead and try and straighten the elbow for me. Go ahead and try and straighten this elbow here. Good. And the person is able to complete the range, alright? That will be a grade 2. Gravity minimized position. Now, from grades 1 to 0, you're still palpating. So you're holding the forearm like this, in 45 degrees, elbow flexion, and the other hand that was stabilizing the elbow initially will be now palpating the triceps group of muscles for muscle activity in attempting to straighten the elbow for grades 1 or 0, alright? So go ahead and try and straighten this elbow for me. The person is unable to perform the movement, but you can still feel some flickering and contraction of the muscle. That will be a grade 1. If it is that there is no muscle activity, there's nothing going on palpation, and there's nothing that you're seeing visually as well, then that will be a grade 0. Alright? So this is MMT, manual muscle testing for elbow extension. Thank you.